Um, the pain in the last couple of decades or 3 decades actually had been a shifting care. The impact has been evident in so many levels, socially, clinically, and regulatory. And in the early 2000s, the JCO, which is now currently the international branch of it, is called the JCI, the Joint Commission of Accreditation for Hospitals, international branch. They've actually emphasized on the pain required to be explicitly assessed. And this is very important because, as I mentioned before, socially, there has been sort of a mandate in the States in the decade of 2010 that it should be the decade of pain control and research. Then clinically, as I said, they've added the pain as a fifth vital sign. And then from the regulation point of view, they've actually put it as part of the organization to get accreditation that they should actually have a proper assessment of pain. And as you can see, if we go back in the history, if we start from the 1846 with the first demonstration of anesthesia with ether, come along all the way until 1990s. Just before that, there was actually the development at 1990 with the BCA IV, intravenous patient control analgesia, and then in 1988 was the first actually acute pain service in the States. And then came along the regulation of different organizations and bodies. In 1995, the ASA, the American Society of Anesthesia, had actually put in guidelines for acute pain service. And then, last but not least, the JCO and now JCI actually had implemented that in the early 2000s. So the trends and the consideration, which is very important because we are actually having a lot of impact from the health care point of view, in terms of economic pressure point of view, and from a society point of view. And there has been a transition from the surgical procedure point of view to go as an outpatient rather than actually stay in the hospital for a few days. So you need to be very aggressive with your treatment of the acute pain. There's an increasing clinical care complexity. As I said, there has been implementation of different guidelines from organizations like the JCI, and increasing patient expectations. Patients do expect now to come out of surgery not having pain or minimum pain, as well as declining healthcare revenue and the stresses of financial constraints.